Video goes with Lab 1, which covers lab safety and the language of anatomy. For lab safety, I want you to read through the most important points that goes over lab safety and make sure you follow the link to do your electronic signature. This video is going to go over the language of anatomy. In order to complete this lab, you will need your lab practice, the most important points, and your lab manual. In anatomy, we all have to use a common language so that we can be specific and so that the information that we're passing on is enough for people to understand the location on the body that we're discussing. So there are a large number of anatomical terms. Some of them are for regions, like this is the cephalic region, and some of them are for smaller parts within those regions, such as the forehead is known as the frontal area. This figure 1.1 is from your lab manual and your textbook, and it gives you all of the terms that I expect you to know for the quiz on this coming weekend, and also throughout A&P and as you continue in whatever program that you go to. So when you're looking at this, the bold words are for the regions, and the normal fonts are for kind of the smaller areas. Okay, so there's a very similar illustration in your lab practice, and so give yourself some practice with identifying these, maybe by writing a list of all of these and then practicing on the lab practice where each of these is on the body. Here is just the anterior terms. Here are the posterior terms. There is also a table in your lab manual, table 1.1, that gives a written description of each of these regions. In addition to the regions on the body, we need to be able to talk about directions. So the front surface of the body is the anterior or ventral surface. The back surface is the posterior or dorsal surface. In quadrupeds, it's slightly different, but we're studying human anatomy here, so we are going to focus on the human directional terms. When we're talking about the trunk, so the trunk includes the head and the torso, we use superior and inferior. Superior being above, inferior being below, and these are relative terms. So the head is superior to the chest is superior to the abdomen, the abdomen is inferior to the chest. Okay. There are other terms that we use for the relationship of the trunk with the limbs, so with the arms and the legs, and those are proximal and distal. Proximal is used when it's referring to something that's closer to the trunk, and distal is used when it's further away from the trunk. We also have planes, and the planes describe how we cut dissected specimens, or they're used to describe how the image of what plane we're seeing in the imaging that we do. So CAT scans, MRIs, X-rays, all are taken in different planes. So if it's a plane that separates the body into right and left parts, it's called the sagittal plane. And if it's right down the middle, it's the mid-sagittal or medial plane. If it's a plane that separates the body into anterior and posterior parts, that's called the frontal plane. And the plane that separates the body into superior and inferior parts is called the transverse plane. There's also an oblique plane, which is any diagonal plane. Next, we are going to talk about cavities. So the cavities, the large cavities, are called the dorsal and the ventral cavities. Each of these cavities is broken down into smaller cavities. Here we have the cranial cavity and the vertebral cavity. Here we have the thoracic cavity and the abdominopelvic cavity. The abdominopelvic cavity is broken down into the abdominal and the pelvic cavity. And the thoracic cavity is broken down into the pleural cavity and the mediastinum. We also have ways of describing the abdominal pelvic region. So, being very general, we have the right upper quadrant, left upper quadrant, right lower quadrant, and left lower quadrant. We can get more specific though and go to these regions. So, the top, we have the hypogastric region on the right and the left, and the epigastric region in the middle. The middle line has the lateral or lumbar regions on the right and the left, and the umbilical region in the middle. And then the bottom row has the inguinal regions on the right and the left, and the pubic or hypogastric region in the middle. So epigastric and hypogastric are related to one another. We might know that gastric is relating to the stomach. Epi is covering, hypo is below. So this is the epigastric is kind of over the stomach. The hypogastric is below the stomach. Here we can talk about lateral. Lateral and medial are other terms that we use in anatomy. So lateral means to the side, medial means to the midline. And down here we have inguinal and iliac. Inguinal is referring to right along the crease between the thigh and the abdomen. Okay, so this crease right here, that's the inguinal region. You can also call it the iliac region because this is the ilium. It's a part of the hip bone, which we'll learn later. So those are the terms, groups of terms I expect you to know. So there's the anatomical regions, there are the directional terms, the cavities, and then the abdominal quadrants and abdominal regions. So what you do from here is you're going to use your most important points. Everywhere you see bold, that's telling you that's something that you want to label on the lab practice. And you'll notice that the most important points and the lab practice pretty much go in order with one another. Okay? And so sometimes there is far more labeled in your lab manual than on the most important points. This particular week, it's about the same. Pretty much the terms that you see in the lab manual are the terms I expect you to know for the quiz coming up. But I want you to always use your most important points as a guide. If it's on the most important points, it's something I expect you to know, and it's something you should be prepared to be quizzed on the following weekend. Any terms that are not on your most important points or groups of terms that are not on your most important points, I am not going to quiz you on. Okay? So this is the first week. It always takes a little while to get going. So we just have this one lab. Please, if you have any questions, post to the class discussion, and we can all help each other out. Good luck this first week, and I look forward to chatting with you again next week.